Hello, everyone. Welcome to the enterprise-wide operational agility platform at Aetna session at Empower. I am Adam Legas. My partner in crime for this presentation is Barney Joseph Schwarzkopf. A little bit of housekeeping we should go over with you before we get started. You're watching this on On24, which offers lots of options for customization. You can find how-to in related content. Also, please use question and answer widget for questions throughout the session. We'll answer some live at the end. So what are we going to talk about today? 4 main points. Quickbase, our Quickbase journey at Aetna, how we use Quickbase as an enterprise-wide agility platform, what the IT and business partnership model we utilize is, and an example workflow from this partnership. It goes without saying these days that flexibility and speed matter more now than they ever have in healthcare. And so, the ability to do this at speed, at pace, is really important to our journey. Which gets to the next slide. That the unresponsive and inflexible tools and systems were a massive impediment for us attempting to resolve this. The 5 basic core issues we were trying to tackle, right? Multiple bespoke solutions. So we had multiple teams doing multiple different things, none of which were the same, right? File-based limitations and confusions. Most of these other platforms we were utilizing were either themselves unique and separate, or would generate individual files. We have to track those files. We have to figure out how to get those files to everybody. How do we make those files accessible? Completely manual processes. So we would develop a wonderful process to solve a problem, only to find out that we have to do it completely manually. So we'd have these electronic tools that would process the work, process the data, but they wouldn't do anything to actually drive the process itself. Desktop software ecosystem, right? It's another big one. So everything relied on a piece of software on someone's company issued computer. Everybody had to have the software. Everybody had to have a company issued computer. Everybody had to be, connected to the corporate network at all times, right? All sort of limitations that make things harder. And then wide variety of applications. We talked a little bit about this in the multiple bespoke one up front, but the big thing here was, we would have multiple solutions and a different large variety of them. So the problem ultimately becomes there's nothing cohesive between them, right? We're stuck with people trying to learn a new way to do everything they need to do. And so those challenges on the next slide lead to several challenges that have negative consequences, right? So we lost employee productivity. That kind of goes without saying, right? If everybody's learning how to do everything over and over again and there's no process that's the same, it's going to take us longer to get anything done. Slow process execution and adherence. Similar vein, right? Everyone's got to learn the new process and then everyone has to do it. And then adherence kind of comes in from, it's not necessarily malicious, right? It's more of they didn't know this process is different. They missed out on a part of it. How do you cover that? Reduced access to data and users and processes. So again, desktop software, company computers, files, right? How do you make sure that someone has the right computer with the right software, access to the file, and that the file they have access to is the most current file? It's a really tricky thing, especially at scale. And then high cost to support these applications. So when you have business areas, and even IT itself, truthfully, when you're developing multiple applications over and over and over, right, you end up in a situation where you have different ways to support all of these different things. And so there's a cost to that. It costs us more to support 9 applications that were individually programmed and have completely different, back-end stacks and everything else than it does to support a single valid solution that could cover multiple options, which leads to the future vision, right? So how can we solve these challenges? What's a great way to try to tackle, these 5 things? So the first one, enable problem solving to develop the problem solver, sorry, to develop the solution. The idea here is to, get the problem solving, get the app building, get the ability to resolve the problem closer to people that have the problem. They know the problem best. They understand what they're trying to do in their business. They understand what they need to do to solve the problem. A lot of times they just don't know how to build a solution that could actually solve it. We also want to create multi-purpose and reusable assets. If we're building something that can operate a particular kind of process, well, it'd be really great if other similar processes can use the same solution, right? With maybe some tweaks, modifications, or a copy. Maybe it's really a separate solution, but a similar process. So, can you copy that solution, reuse use it as a skeleton, right? And then just solve the particulars. That gets to also sort of number 3, increasing the scope of problems to be solved. So can we utilize this opportunity to basically enable us to solve more problems, right? The idea is we don't necessarily want to, we don't want to solve anything that's not already being solved. We want to still solve those, but can we grow the number of problems we want to solve? Can we go beyond what historically IT is capable of resolving? And then number 4, less disparate solutions to manage. So, again, similar tie to number 1, right? The thing here is, can we get things that are more the same, more closely identifiable to each other, both for the ability for users to understand and operate them better, and for us as support staff to be able to go ahead and, have less differences to try to support. In other words, we have the same process we can follow to support a similar solution, which basically gets into the ideal solution, right? What we're looking for is something that would increase employee productivity. I mean, everybody wants that all the time, right? That's probably not anything anyone on this call is unfamiliar with. Increased job satisfaction. That one's personally near and dear to my heart. I think it's great that we can, make the company faster, better, stronger. But for me, it really hits home when we can make people's jobs better, easier, make their lives actually better, right? Increased IT support capabilities. So this is actually kind of a cool and fun one. So if we have to support less things, we can support the things we have more deeply, right? And so that's really, really critical in sort of being able to achieve this. So that if we don't have 9 platforms that we're trying to solve something on, we have 1. We can go deeper into how we can support that 1 platform. We can do more, we can do better, right? And then decreased IT support costs. So kind of hand in hand, even though we're going deeper, we only have the 1. So we don't have to get up to speed on 20 different software stacks. We don't have to try to explain to folks, how to use 9 different tools for different processes. Have our help desk troubleshooting, 1,000 plugins and whatever else have you. So just lower our overall ability to effectively support these solutions as they go. So the solution to that leads to our overall second bullet point, right? Which was enterprise-wide agility platform. So we deployed Quickbase across our entire healthcare business. This includes strategic, tactical, and ephemeral solutions. Basically, we have some solutions in Quickbase that are 15 years old. We have some that have a very finite lifespan. We know when we put them in, effectively when we want to take them back out, replace them either with another app or potentially a larger back-end system, or maybe an existing back-end system will pick up this new line of work eventually. We have to fill the gap in the middle, right? And then the really temporary solutions. So, it's things like people have, let's say, a bunch of disparate data they're trying to pull together. So they draw this all into a Quickbase app, format the data, get everything they need set up and work on it with their team. And then now they have the final data set they're going to promote to another system, right? So then they export the data, remove the app, it's not needed anymore. And so these kind of things cover a ton of different use cases: data tracking, transformation, consolidation, project management. So lightweight project management, right? Workflow automation. So basically processes, right? Are there steps in processes where we can have Quickbase, we can have the tooling perform it for the users. The users don't have to actually do that step anymore, right? Straight savings and happiness there for everyone. And bespoke processes. So you're never going to get rid of the bespoke processes, because I know I talked about those earlier being kind of a problem. But if you can at least centralize them into one platform where you need to support them, at least then only the process is bespoke, right? So the tooling to drive it and everything around it remains, not unique. It remains the same for everybody. Just the actual process itself is bespoke. So how do we get to that, right? Sounds great. How do we get there? That leads to our IT business partnership model. And so basically the answer to that is a strong collaboration between IT and the business, right? We pretty much break this down into two halves. There's IT, who's me. I operate and support the Quickbase platform itself, right? So I make sure that on a day-to-day basis, we're checking all the boxes for regulatory, legal, auditing, our own company standards that we've established for anything, right? Passwords, identity, email, right? All this kind of thing. Everything I take care of, sort of the platform, what I like to call the hard stuff. And then the business half. So business half builds the actual solution, right? They're going into Quickbase. Barney and his team is going into Quickbase. They are actually identifying their problem in the business, and then they're building their app to solve it, right? And they get help from me and my team as it's needed. So we're not going to leave anybody stranded. The business isn't out there sort of flailing in the wind, hey, here's this tool, maybe it'll solve your problem, right? But the idea is to empower those people, empower our business partners to be able to solve their own problems. And that gets to something that we talk about on the next slide here that is sort of central to Aetna. And that is, our management at a while back made a very conscious decision to empower employees across the enterprise. And this meant everybody. I'm talking from the people that answer the call center when you call in for help to, the CEO, not that, he wasn't empowered anyway. But the idea was that everybody in the company would become empowered to solve business problems in their space. Now, why do they want to do that, right? The idea was kind of actually somewhat straightforward and simple, that if we empower the employees, they could find new efficiency gains, solve problems either we didn't know we had or problems that otherwise would go unsolved, and they could do it in a way that was really satisfactory to the company, right? So the goal for us is to, on the IT side, is to enable that. How do I do that, right? So I have to constantly adjust the configuration of Quickbase and similar software platforms and all of our processes around the platforms to enable, Barney and my other builders to do this while at the same time still meeting the standards the company wants us to have, right? It's very paramount that, and very important to the story, that we're not really giving anything up in allowing the business to do this. We're effectively creating an area for them to do it, but we control that space. And this works well for everybody because we control the space, which means Barney and company, when they're trying to build their apps, right, they don't necessarily get in any trouble. And that's sort of the goal, right? I want to get to the point where the only thing Barney has to worry about is actually solving his business problem. All the other stuff, hey, browser upgrades coming, we're changing the desktop build, the government changed the encryption standard, hey, there's a new best practice on identity, right? All that's on me. I want to take that off Barney's plate. All I want Barney to do is focus on solving his application, building his application to solve his problem. And I'm going to go ahead and take care of all the other stuff. So that leads to continuing to improve the model, right? In other words, just like we talked about, things are constantly changing. So how do we deal with that, right? Biggest part, agile mindset, iterative solutioning. Everything can be changed, and we look at where we are at a point in time and then where to go from here, right? So very much like agile with a backlog, it's things are in our backlog that we know we want to do. New things can be added to it, right? New challenges, new problems, new feature might pop up that enables something. And we're constantly, delivering something, going back to the list and saying, okay, what's the next highest priority thing on this list we want to deliver? And then deliver that to keep expanding, growing, changing the platform. Reducing the complexity. It's another huge one. So Barney and Company, right? Number one, they're not IT. We can't expect them to be. We shouldn't expect them to be. And also, on top of needing to build an app, don't forget, all these folks, they have their actual job to do, right? These folks, they're not just application builders, they're also analysts. And, they're also managers. They're also call center folks. Like, they all have an actual, 8 to 4 we're paying them for, right? So we need to lower complexity as much as possible. We need to make it as easy as possible for Barney and his cohorts to solve these problems in their apps and to manipulate the platform to develop a solution that makes sense for them. Adjust support to changing business needs, right? So that gets back to the agile mindset, right? Constantly looking at the business around us, listening to Barney and the business for what their roadblocks are. What are your problems? What do you wish you could solve, right? And then basically looking at our backlog, adding to it or implementing things from it that can drive that going forward. And then lastly, leveraging platform capabilities to expand the scope. So, we've already expanded the scope by moving this to the point where Barney and his team can develop a solution, right? That's going to enable those teams to solve problems that traditionally IT wouldn't have tackled, either for cost, size, variety of different reasons, right? So as the platform grows, as a platform can do more, as the platform becomes capable of different things, we can leverage that to further allow, Barney and others like him to solve new and different problems, right? So they're not just limited to the problems they run into today or what Quickbase can do today. As things change, the problems they solve can change. And so we're constantly growing into different problem spaces we can solve. So I think at this point, I think one of the things you might be here for as well is to sort of, how does this work, right? What is the outcome of what I've talked about? So that's where my partner Barney comes into play here. And so we have an example of a system he's built that covers a clinical workflow that the Aetna healthcare business actually has deployed to great success. So I'm going to hand it over to Barney, who's going to talk a little bit about what he's built, and then we'll come back at the end and talk about some of our key takeaways and answer questions and answers as well.
Thank you, Adam. Appreciate the intro. And I'm going to talk about where we deployed this today in our business to be very successful. The next slide, please. So as you see here on the slide, this is our before work case, nurse work case flow in our business, right? So we started looking in our clinical spaces where the nurses were performing the work, and what we found in the depiction that you see down here is they were leaving, they were context shifting, they had multiple Word and Excel templates, which really kind of led us right into the next slide, driving us right. What were the challenges that we had prior to Quickbase, right? As I just alluded to, we had multiple Word documents accumulating, ultimately entering multiple data in separate back-end systems. This driving a lot of consequences, negative consequences that, as Adam spoke about earlier, was data was bespoke in multiple files and multiple SharePoints, which then drove, we have version control. Data wasn't always accessible, the latest and greatest data wasn't always accessible. And nurses spent a lot of time rekeying in the same information into multiple Word templates, Excel templates, which drove a lot of version control and quality issues. A lot of these are static, heavy manual data input tools that we have within the business, and it drove a lot of duplicative documentation due to these being static documents, and we had a variety of multiple spreadsheets on the SharePoint site. So you could imagine it drove some compliance challenges that we had to hurdle. And that leads us into our next slide, which we are using Quickbase as a strategic tool to drive standardization and efficiencies with one platform for data entry. And we then, in turn, this really is enabling us to drive our compliance adherence, right? So now we can have a single platform that the nurses then are able to not have to go off and contact shift, not have all these Word documents and Excel spreadsheets shared on a SharePoint. They're able to use Quickbase as a strategic tool, having everything integrated on one platform and no longer needing to have 15 to 20 different templates in order to complete the work that they need. We are really enabling the business to leverage the agility of the tool by training the staff, right? And that's the key piece here is we build these apps and they are staff maintained. They own the application. As new compliance issues or compliance changes, state and local federal guidelines change, the business has been enabled and empowered to basically make those changes on the fly. So it was a huge win by being able to leverage this platform. Next slide, please. So what is the vision ideal state with Quickbase, right? It's a single location to log their work supporting editing, live, current reporting, right? So they have, what we gain from that, right, is a significant increase in nurse efficiencies, driving tremendous improvements in our data accuracy. There's no more version controlling. There's no more 10 sources of truth, right? We have a single source of truth driving, right? And then the nurse job satisfaction. At the end of the day, not having to enter in the same information into multiple systems, multiple spreadsheets, Word templates, and it really is driving a more streamlined, efficient process to, at the end of the day, not only meet our customer, but make our internal customers, which are our nurses, our MDs, the folks that work every day, happier, right? Helping them help our members and customers drive a more qualitative process, right? Driving standardization, right? Not having maybe version controls or having the latest and greatest Word document. Might have missed one off the SharePoint. Having Quickbase really drives that standardization and centralization of data. And really a huge piece was eliminating process by automation, being able to integrate with the existing core business systems and make things seamless. Feel like your work is in a true flow, right? And being able to address, like I alluded to a little bit earlier, as the business changes, right? We're in healthcare, so it's a never-ending, constant flux of change. Things change all the time. We need to have a tool that can, as the industry changes, be able to change with the industry and pivot on a dime. And this really by enabling the SMEs within the business to be able to update, change, make those changes locally and what I call real time, right? We could have a mandate come down from the government or what have you and have an update almost by the end of the day, depending on what the parameters are. So this really has enabled us to, be next level and drive that alignment across the three big business segments, right? We have Medicare, commercial, and Medicaid, and being able to drive alignment across three very complex business segments is a huge win for us, without a doubt, right? And then being able to eliminate the need for some of the SharePoints, the Excels, the Word documents, archiving those and getting them out of the process and having a more qualitative and efficient process. Really drives us into the next slide. Well, how do we utilize the Quickbase for business transformation, right? And this is the right, the recipe, our recipe for success here. We go in and we conduct an end-to-end business analysis, process mapping, understanding where the inefficiencies are, the pain points, understanding, the struggles the frontline folks have every single day to get their job done, and that's how we identified a lot of these SharePoint sites, the Word documents, the Excel, and right, as we identify these, it's like, oh, this would be perfect for Quickbase, right? And really identifying where those strategic places within the end-to-end process that we have would be for a deployment for a Quickbase app. And then once we identify those, we basically train up the SMEs, right? We start building the application for the solution, and in the same token, train the SMEs within the business. So once we go live and deploy the solution, they are fully self-sufficient, right? The only time we kind of touch base is we have a monthly review and assessments to support all the applications. So we touch base on a monthly basis to see how are they going, how's it going? Do you have any struggles with the application? Do you need any help? And a lot of times things are, moving smoothly. No, we're good to go. But here's the cool part. I've learned from a lot of the folks that I've trained up some new tricks. They say, hey, can we do this? Can we do that? Can we try to do that? So, it is a truly iterative process to where we kind of solicit on a monthly basis, understand the problems, the issues, concerns, anything help they need, but then also how can we make it better? Or what ideas did they have? So it's a true iterative fashion that we look to employ in our business. And really, it gives us the flexibility to adapt and switch around the specific regulatory needs, right? Gives us that flexibility to be agile within the business and really stay adherent to as the governing bodies change, so on and so forth. We can move with them without any gaps in our business. Next slide, please. And now that, right, this is our key takeaway between partnership between IT and the business here. And I think, right, really utilizing the partnership between the business IT is critical. Establishing the user empowerment platforms like Quickbase, right? IT needs to establish and maintain a platform that empowers the users as much as possible. Adam does a phenomenal job. Him and his team are absolutely amazing in enabling myself and the business owners to give us the maximum flexibility to solve our problems. We never have to worry about the issues that Adam has talked about earlier in this presentation. He gives us basically a platform to build and maintain our solution, enabling us to solve our problems, increasing our operational efficiency, and being agile in a rapidly changing marketplace. I think Adam and his team are absolutely phenomenal in enabling us to solve business problems in real time and make not only our members and customers happy, but our internal members, both the nurses and doctors and everybody we support. This tool has really made their lives a lot more efficient, easier to process the work, and has been a success across the board. So thank you. Adam, I don't know if you have any closing remarks you'd like to finish.
Yeah, no, Barney, I think that's really well said. And I think, another key takeaway, maybe it's not listed on this slide perhaps, but I think it's worth reiterating sort of one more time, is that I'm in IT and Barney is not. Barney works for the business. He's in the insurance side. He's on the side where, like they're actually the people figuring out like what's covered, what's not, who's trying to get doctors in, right? Like, and that's so critical to understand, is that, that he is building these solutions. He is rolling out these solutions. His team and these nurses and these doctors, they own these. I'm just providing the tools. He's taking them and building something with it. And that's really, really the key, right? The two of us coming together and him being able to do that. That's sort of the secret sauce, for lack of a better term. And so, I think hopefully some folks have some questions. So I think on our next slide here, we've got some information on where you can go as part of the Empower Slack chat to ask us some questions. We'll also look for questions in the chat below and try to answer anything we can for you guys.
Definitely. Thank you all. Appreciate your time.
Yes, thank you so much. Looking forward to answering any questions you may have.